The herpes simplex virus, or HSV, is a common virus that causes lifelong infections. There are two main types, HSV1 and HSV2. HSV1 typically causes oral herpes, also known as cold sores or fever blisters. These usually appear around the mouth. HSV2, on the other hand, is primarily associated with genital herpes, which affects the genitals. While HSV1 and HSV2 have their preferred sites of infection, it's crucial to remember that either type can infect both oral and genital areas. This means you can get genital herpes from HSV1 and oral herpes from HSV2. This is important to keep in mind for prevention and understanding transmission. Both HSV1 and HSV2 are incredibly common worldwide. In fact, a large percentage of the population has at least one of these viruses. While many people never experience symptoms, understanding HSV is essential for everyone's health and well-being. HSV spreads through direct contact with an infected person. This can happen through kissing, sharing utensils, or sexual contact. Importantly, HSV can be transmitted even when someone doesn't have visible sores. This is called asymptomatic shedding. During asymptomatic shedding, the virus is still present and can infect others, even if there are no outward signs of infection. Once HSV enters the body, it targets cells in the skin and mucous membranes. The virus replicates within these cells, leading to cell damage and the characteristic symptoms of herpes. After the initial infection, HSV travels to nerve cells called sensory neurons. Here, the virus enters a dormant state known as latency. During latency, the virus remains inactive but can reactivate periodically, causing recurrent outbreaks. Triggers for reactivation vary from person to person but can include stress, illness, or sun exposure. Understanding the transmission process and the virus's life cycle is crucial for managing HSV and preventing its spread. Herpes symptoms can vary widely depending on the type of HSV, the site of infection, and the individual. Some people experience no symptoms at all, while others have frequent and painful outbreaks. Oral herpes, typically caused by HSV1, often presents with tingling, itching, or burning sensations around the mouth before blisters appear. These blisters, often called cold sores or fever blisters, can be painful and filled with fluid. Other symptoms of oral herpes can include sore throat, fever, swollen lymph nodes, and difficulty swallowing. Genital herpes, primarily associated with HSV2, often causes painful blisters or open sores on the genitals, rectum, or buttocks. These sores can make urination painful and may be accompanied by flu-like symptoms such as fever, headache, and muscle aches. It's important to note that some people with genital herpes experience only mild symptoms or mistake them for other conditions like ingrown hairs or yeast infections. While most cases of HSV are mild and manageable, there can be complications. Herpetic whitlow is a painful infection of the finger, often contracted through contact with herpes sores. Herpes gladiatorum, commonly seen in wrestlers, spreads through skin-to-skin contact. Eczema herpeticum is a severe skin reaction that can occur in people with eczema who come into contact with HSV. In rare cases, HSV can lead to more serious complications like eye infections, encephalitis, which is inflammation of the brain, and neonatal herpes, a serious condition that can occur when a baby is exposed to HSV during childbirth. Diagnosing HSV typically involves a physical exam and a review of symptoms. Your doctor may take a swab of a sore for laboratory testing to confirm the diagnosis. While there is no cure for HSV, antiviral medications can help manage outbreaks, reduce their frequency and severity, and lower the risk of transmission. These medications work by interfering with the virus's ability to replicate. Living with HSV is about understanding the virus, managing symptoms, and preventing transmission. It's important to remember that even though there is no cure, HSV is a manageable condition. By taking steps to care for your health, you can live a full and healthy life with herpes.